Good morning. This is Lyle. It is Wednesday, the 8th of May. It has been exactly a week, or will be at 2 something this afternoon, since I had my pump disconnected on the 7th round of chemo infusion. That round is the next to the last, and it's been pretty miserable for a lot of the time, but starting to get better. The fog is lifting a little bit. At least part of the day, the last day or so. Still, not much going on as far as energy or anything exciting, but hopefully we'll make it through. One more infusion, that is the 13th, which is Monday, provided that I pass the tests on Friday, the labs, that my blood cell counts are good. I'm still dealing with this tongue thing. This is really irritating because the back of my tongue on this side of my face is just so sore. Makes it hard to swallow. Excuse me. Sometimes I have to swallow. Makes it hard to talk sometimes. So far, I haven't gotten the splits as bad in the side of my face. Usually both sides split out. This side started yesterday, but I don't feel it as much today. I did have, one of the joys of this is sometimes you have urgent bowel movements. I did have one yesterday, and it was the fourth one that I did not make it. It was not pleasant. It was probably the worst yet. So anyway, that was fun and nice cleanup. Anyway, I know that's too much information, but that's just part of this. We met with the surgeon yesterday to try to formulate plans for the future. The last infusion being the 13th, they try to wait 3 to 4 weeks before they do testing, just to let the cumulative effect, I can't pronounce L's with my tongue like this, cumulative effect, take as much, benefit, we get as much benefit out of it as possible, as far as reduction or disappearance, hopefully, if we're lucky, of the tumor. So the schedule is the first week of June, I will have the MRI, which will determine size of the tumor, where it is, lymph nodes, to see if that's gotten clear or not. The week of on the 13th of June, which will be exactly a month from the last infusion, I'll have the flex scope, which will determine exact placement and size for surgery, if it's still there. And then the 20th, I have the meeting again with the surgeon to go over what's going on. Of course, I'll know pretty well by that time whether it's there. He said there's a 20% chance the tumor just disappears, but if it does, there's a good likelihood it will reappear. So you have to constantly monitor with MRIs and things. So, that isn't a great thought for the future, I guess. I don't know. It'd be nice if it disappeared and just never come back. But if it comes back, then you have to go through this again. Actually, he said they wouldn't go through it again. If the tumor comes back, they don't do the chemo. They just go in and take it out. Because it wouldn't be as big. If it's not back, the most likely outcome is a colostomy. And because of the placement, it's still most likely, if it didn't shrink appreciably, that it will be a permanent colostomy. So at least I'll never have to worry about having urgent bowel movements again. Got to look at the bright side of things some days. The time frame is, I asked him how long the surgery would take, and he said, for you, about a second. He said, you go to sleep and then you just wake up, and he said, it's done. He said for him it's probably a little over 3 hours, so it's a fairly long surgery. There's about a 4-day give or take time in the hospital, and then from there 6 weeks recovery time until you feel fairly normal again. The thing I'm looking forward to right at this point is after the 13th, no chemo. And all these effects hopefully will go away. The tingle finger, the cold sensitivity, the tongue problems, the lethargy, the foggy brain, the stumbling and tripping and sometimes falling, although it's only happened once or twice. But it's just, a lot of things going on. And the taste in my mouth, it'd be nice to taste food again the way it should be tasted. Hopefully all that will disappear in those approximately 10 weeks probably before surgery, because we're looking at 4 weeks before that. Well, it could be 7, so say 7 to 10 weeks. I'm expecting it if we're doing surgery sometime in July, probably mid to late July. If the tumor is there, there's no great hurry for surgery because the chemo has done what it's supposed to do, hopefully, and stopped any spread. Again, this is stage 3 locally advanced rectal cancer. One thing I have to stress is remember that cancer screening saves lives, whether it's rectal, colorectal cancer, or any other cancer. Make sure you get screened. Because for me, again, I had no idea that it was there. I had no symptoms that I would have suspected would be cancer. And so it's just a thing you have to do, because you can't depend on your body or your mind to say that, things are good. So anyway, at least the plan is set now. We'll check in again once we get that last infusion. Hopefully that goes smooth, and we can go from there. So have a wonderful day, rest of the week and weekend, and we'll talk to you sometime next week. Thank you. Bye.